Welcome to our introduction to Medicare. Today, I'm going to share with you a visual presentation to help us follow along. So let's get started. Medicare has three key parts. Part A, hospitalization. Part B, medical or doctors primarily. And Part D, prescription drugs. Not over-the-counter drugs, but the drugs, the medications that are prescribed by a physician. All Medicare plans have A and B, and then we find a way to get the prescription drugs covered as well. So Medicare always consists of parts A and B, and it is crucial for every policy. As Medicare enrollees, maintaining our Part A and B status is your responsibility. It means meeting qualifications and paying premiums when required. Losing Part A or B can be a massive hassle to fix, so let's avoid that at all costs. Let's begin with a little bit of history. Medicare originated in 1965 under President Johnson's administration. The first beneficiaries were Harry and Bess Truman, just for a bit of trivia for you. Original Medicare is what was created at that time, and it includes Part A, which covers the hospitalization, and Part B, which covers medical services. Think of Part A as the hospital's framework: the emergency room, the operation room, patient accommodations, including food, nursing, utilities. It includes skilled nursing facilities like rehab centers, also called TCUs or transitional care units, and hospice services for end-of-life care. Part B, on the other hand, caters to medical expenses such as doctor's visits, specialists, and durable medical equipment like walkers and wheelchairs or continuous glucose monitors for diabetics. It also includes certain injections given in a doctor's office or a pharmacy, but not all injections, like the shingles vaccine, falls under Part D. Now, why is Part D crucial? If you skip enrolling in a Part D plan, you risk a lifelong penalty, which you ultimately opt in. The penalty is roughly 1% of the premium for every month you lack prescription drug coverage, and that mounts very quickly over the years. For Part A premiums, if you've paid 40 quarters of FICA over the years of your employment, Part A is generally premium-free. Married couples benefit if one has contributed these quarters. The other spouse will benefit from that, not having to pay Part A premiums either. But remember, if your marriage lasts less than 10 years or upon death, then your individual contributions to FICA will determine if you've met the 40-quarter requirement. You can find how many quarters you've contributed by checking out your portal at www.ssa.gov or www.socialsecurity.gov. There is an annual deductible tied to Part A. If you are still working with employer-based insurance, this deductible might be covered by that group coverage. The Part B premium is determined by what your adjusted gross income was 2 years prior. So there's always a 2-year look back. So that number is dynamic. It can go up or down from year to year. The IRS will advise Social Security and Medicare what your Part B premium will be from year to year. But know that you can defer Part B if you have employer-based insurance. Let's touch on why many opt against only having original Medicare. There are potential high out-of-pocket costs, such as the Part A deductible and 20% of doctor bills in Part B. This leads many to choose between Medicare Advantage, or also known as Part C plans, or a Medicare supplement, also known as a Medigap plan. We will go into more details shortly. Part B deductibles vary, determined by when you enrolled in Medicare. If you enrolled in Medicare starting January 2020 or later, you are responsible for the Part B deductible. But if you enrolled in Medicare before January 1 of 2020, you are exempt from the Part B deductible. This is determined by a rule called MACRA, M-A-C-R-A. Thanks for watching. Don't forget to like and share this video with someone who might benefit from understanding Medicare eligibility. Take a look at our additional videos to raise your understanding of how Medicare works and how it can work for you. We are Pearl & Company, licensed brokers in multiple states. Should you have any questions or need further assistance, feel free to contact us at 651-303-8889. We are here to assist you on this journey.